Hey there, everyone, and welcome to today's webinar, Return to Operations FAQs, Prioritizing Health and Safety. My name is Alex Campione. I'm the Director of Sales Enablement here at Corporate Traveler, and I'm so excited that you all have joined us today. I've also got the lovely Marcy Howard, who's going to be co-hosting. She's our VP of Sales, and of course, we are very delighted to welcome our special guest today, International SOS, and more specifically, Dr. Miles Druckmann. I think that it's going to be a really valuable conversation, and I'm really excited because the content has been sourced from questions from our clients, our account managers, and really just getting a pulse of what you want to know most about. With that being said, we are going to aim to go about 45 minutes today. Not sure that we'll have time for questions at the end, but if we do, of course, we'll try to get to those. Before we do kick off, just a couple of housekeeping items. The first one is that today's session is being recorded, of course. It will be sent out in about 24 hours after this broadcast, so you'll receive that in a follow-up. And then the second one is, again, we will probably not have time for questions, but if you do have some, you can always chat them in and we'll aim to either get those answered in a follow-up or maybe at the end if we have a couple of minutes left. So without further ado, let's go ahead and jump right into it. All right. So today's agenda, we're just going to kick off with some introductions, talk about International SOS for those of you who might not be as familiar with them. Then we're going to get right into the questions. So focusing on return to operations, return to travel, of course, something that we all want to know about, immunity and antibodies, and then also some resources for continued education. All right, so just to kick off, I know I've been hosting these webinars the past couple of times now, so just a kind of a proper introduction of myself. My name is Alex Campione. Like I said, I'm Director of Sales Enablement here at Corporate Traveler and Stage and Screen. I'm based in San Francisco. Been with our company almost 5 years now, which is totally crazy, and held a couple of different roles, including being in sales, being our tech sales engineer, and actually I was trained by the lovely Marcy Howard, who we'll go ahead and pass it over to now to introduce herself.
Great, thanks Alex, and thank you all for joining today. As Alex mentioned, I'm Marcy Howard. So I'm VP of Sales for Corporate Traveler and Stage and Screen, and I've been with the organization for nearly 10 years, which is also crazy just to think about that. But as many of you on the webinar know, the customer size that we partner with is that startup to mid-market organization. So this means our clients wear many hats within their job duties, so especially now, right? So our goal for this webinar is to provide expertise to you on how to return to operations and also how to return to travel so that you feel confident in taking care of your employees. So on that note, I'd like to introduce you to Dr. Druckmann, who is joining us from International SOS.
Hi, everybody, and thank you for having me today. I'm not going to read any of that on the screen. You can kind of see it, but been working with International SOS for over 20 years. So we went 5, 10, and 20. So there you go. Spending a lot of time over the past, 15 years doing pandemic planning. So very much apropos to this crisis we're in today. It's a lot of the work that we've been doing as an organization to support, this crisis that everyone's kind of fighting through today.
Excellent.
And if I'll just, as an introduction to International SOS, we've been around for over 30 years, and the organization started, interestingly, in Asia. Has now expanded globally. We have over 11,000 employees. A third of them are medical. So it's a very heavily medical and security focused organization. And our key focus has been on international traveler and expat populations. And interestingly, though, over the last 4 or 5 years, we are getting and working more and more with the full organization. So looking after the total workforce and really helping them identify risks, manage those risks, and have health and safety travelers wherever they go around the world. And we provide this service for all industries, government agencies, NGOs. In essence, when there's a crisis, unfortunately, around the world, we're typically one of the first groups that are there, and both evacuating people as well as supporting them on the ground. And so it's quite a diverse organization. I'm actually Canadian, working in the US, married to an Australian, and that's pretty much international SOS. We're from all over the world with multiple languages. And we're really there on the ground in over 90 countries, where we are literally managing cases 24/7, handling phone calls from people, everything from minor, health and safety issues to major crises, the full spectrum. So when it comes to issues like, this COVID pandemic, it's exactly kind of what we were built to do, is to help organizations kind of through these types of crises.
Definitely.
And so, what have we done today? So interestingly, we have been watching this coronavirus outbreak really since December, and very much with our focus in Asia when this was happening in China. And we developed plans for COVID within the first few weeks. We actually created a new respiratory illness plan even before we knew it was coronavirus. And since then, we have a dedicated website that helps managers, address all the multitude of issues around this particular threat. We're collecting all the data and able to do reporting. And particularly when it comes to travel, you'll see that we have data on what are the restrictions that are in place at airports, at airlines, at countries, and we have modeling and projecting kind of what's going to happen in the future. And then we have all the communication tools to really help you as an organization get the right message out to your people. One of the challenges in a crisis like this is that the information changes incredibly fast. And the frequently asked questions literally is changing every day. And so hopefully we can be a central hub of information. And so we kind of collate what the World Health Organization, what the CDC is saying, what the ECDC in the UK and Australia and Singapore and China, and we try to consolidate that into a consistent kind of business level communication tools that allow your people to safely get where they need to go and understand the risks in an effective way. So that's really kind of our objective, is to try to make sense of all the confusing messages that are out there and make them business ready for your organization.
Definitely.
Great. Yeah, I think that really marries into the next conversation when it goes to return to operations. So Dr. Druckmann, we received quite a few questions from our clients around how to return to operations. So just wanted to share a couple questions with you and get your insight and feedback here. But one of the first questions we were asked was, we're already starting to see that states are varying state by state when reopening, but when restrictions loosen, how would you determine who is allowed to return to the office versus who still needs to work from home?
Yeah, look, this is a great question. And, within the US context, as you know, US is a big territory, lots of space between us, between cities and counties, some areas being very dense, with lots of population, other more sparse. Other areas that are having outbreaks that are going on right now, other areas where there haven't been any outbreaks yet or very minimal. So there's not a uniform answer for what is happening, and that's why you're seeing states, do things at different times about opening. And also you're seeing that, it's par for the course in a pandemic, in that you're going to see pockets of areas that are being more affected than others. So it's a dynamic, changing environment, and I think it's a challenge for all government agencies to try to get their arms around what's happening. It's obviously well publicized about the challenge we have with testing, and if you don't know how many people are sick, then it's very hard to make judgments, and therefore you generally often have to be more conservative than if you had a lot of information. But from an organization's perspective, I think what is really important is that the government is going to, make their decision, and it might be done at a county level, it might be done at a state level, it might be done at a city level. And then the first thing that an organization needs to understand is they have to follow, or they should be following, that guidance as a first step. So you don't want to be opening up before the local authorities tell you can. I mean, that definitely puts you at risk and exposes you. That being said, when your authority says, yes, you can open, it doesn't force you to open. And I think that's the other key point, is that you as an organization need to be comfortable that you have all the systems in place to support your people in the workplace. And not only that, to also support, if you are in this business, the customers and other visitors that come into your workplace, and you can protect them too. And then the third factor, which is very important to all businesses, is that if in the community everyone is too nervous to come into your workplace, should you still be opening up? And so I think a lot of businesses are going to say, look, I have a shop, and if everyone's too nervous to come into my shop, should I be open and paying my staff to sit around and wait for someone to come in? So I think there's also that business decision of when is it right, for not from a safety and a business decision to open up their facility. And you're going to see governments, and you're already seeing this already. I'm in California, so they have a whole staged approach about how people are, what type of facilities are going to open first. And generally, they're going to come around the guidance of the proximity. Of course, we talk about social distancing, so those operations where they can control the social distance of people, they can control the place of where people are coming together and minimize the exposure of those people, minimize them touching and interacting with each other and with their products, and that they have all the appropriate, personal protective equipment and hand sanitizing equipment. All of those factors will play into when you're comfortable with your staff, going into that work environment. The other interesting or important factor for organizations is this concept of vulnerable or at-risk staff. So you want to make sure that your staff are comfortable in self-identifying themselves if they have a chronic health condition that is specific to increased risk for COVID, and that those people may be the last people to come into the workplace or continue to work from home if they can. And so all of those factors, I think, play a role. And the other key factor here too is that this is a dynamic situation. Everyone may be healthy today. Unfortunately, they might get sick tomorrow. And so how do organizations continue to monitor their employees on a daily basis? And so that's another part of the process too, is that, yes, I'd like to have, my young, healthy people come into the office, but I also need to monitor them, because if they have family members that are sick at home, if they've been in contact with someone who's sick, or if they're feeling symptomatic themselves, you don't want them coming into the workplace. So we're seeing some technology tools help address some of those issues.
That's a perfect segue into the next question that we received, which was right around that. So what would be your recommended protocol around screening employees, such as temperature checks every day?
Yeah, and again, we have to think about, are we looking at this in a US context or more globally? Because again, the first factor every organization is going to look at is, what is my community authorities recommending, and also in some cases mandating. So in some locations, you are mandated to actually do temperature screening at your door. You actually physically have to put some of these systems in place. Other governments are recommending for you to do it, and then others, it's more laissez-faire. I think the important thing about screening is to understand that, first of all, it is just an additional layer of protection. It is not foolproof at all, right? So we know that people can feel perfectly fine and are asymptomatic and will pass through any screen and can still be carrying and transmitting the virus. So it's not foolproof at all. It will not stop those types of people, of course. but it is a barrier. And what you want to ensure is that people are comfortable that if they're not feeling well, first of all, they don't even come in to get screened, they stay home. And that you identify those people that need to come into the workplace, and that you are giving them ideally the ability to answer certain questions around, have they had a contact, have they been to certain locations that are at high risk, and also do they have any family members that might be exposed or ill. And if they answer all those questions correctly, then they would go in potentially to the point of entry screening process, where some companies are doing temperature screening. And temperature screening as well, there's pros and cons. As I say, a lot of patients, a lot of people that have COVID do not have a temperature. People can take Tylenol before they come into the temperature screen, and even if they have a fever, it won't show it. And so again, it's not foolproof as well. And also it puts the screeners potentially at risk. So you have to have someone at the door that's going to use the proper equipment and have all the proper gear and PPE to take the temperature properly. And then you need to have a process to say, if you get a positive temperature, what are you going to do? What's your process for that at the door? So to do screening properly, you have to have all these procedures in place. That being said, it's not that complicated, right? You can do it, and a lot of companies are doing it. And then we are seeing in some industries, particularly the heavy industries, remote site operations, where some companies are actually doing testing now. And so you're seeing testing coming into the market, particularly outside of the US, where tests are more available. And there's also rapid tests that are available too. Again, there's pros and cons to that, and I think we might talk about that in more detail a little later in the session.
Yeah, for sure. This also brings us to how to return to travel, right? Because a lot of the listeners on the line either travel themselves, or they have staff that travel. So a lot of questions that we received from our clients were around this. So Dr. Druckmann, what are the criteria that you would follow for essential domestic travel first?
Yeah, look, preparing to travel or returning to travel, that's the big topic that we're starting to speak about just this last week, and we're having more content coming out, next week on this subject. I think there's kind of two parts to the concept here. One is the ability for the organization to assess where the traveler is going, even if it's domestic in the US here. And there's a number of things that they would want to look at before someone would go on a trip. They're going to want to look at what is the local COVID outbreak situation in that area where they're going to be visiting. They're going to want to know what the travel and airport process is, and be able to orient and educate their traveler to that. They're going to want to think about every step along the way of both getting to the airport, going through the airport, picking up transport on the other side. They'd want to know what hotel they're staying at and what systems are in place at the hotel to protect, the hotel guests. And then ultimately, when they are going to their meeting or doing their work, what is the work environment they're going to be in? Are they in a meeting with 50 people, 100 people? What are the implications to where they're meeting, and the kind of work that they're doing. So every industry is going to be different. We know that, for example, we've been talking to law firms, and they have to travel because if they don't go to court, their suits are going to be thrown out, right? So they need to know what's the courtroom situation. You have others that are working in the pharma industry, and they're having to go visit hospitals. Well, that's a much higher risk situation. So what do they need to protect? How do they need to protect themselves? So one is the assessment. The second is, so based on that assessment, you want to decide, is this a go, no-go situation? So if there's certain criteria that you're uncomfortable meeting, the risk is too high, there's a major outbreak in that area, the hospitals are overwhelmed, the airport screening is, people are going to be put into quarantine when they arrive. There's certain criteria where you say, this is a no-go situation. But assuming that it is a go, the next question is, how do you prepare the traveler? And preparing the traveler, you're going to need to look at all of those steps. Okay, orienting them to the COVID-19. What are the things to do? Obviously, the regular hygiene and social distancing, ensuring that they have all those things, making sure they have all their personal protective equipment, making sure that they are oriented to the challenges there and the implications that they could be quarantined because things can change. When they're on their trip, they need to be monitored, so they can monitor their own health, they can report back to management. So I think we're going to see a very, very tight monitoring process, at least early in the opening up of travel, and that it really needs to be business essential, and you want to ensure that your traveler really has all of the tools ready for them to go. We're getting a little feedback from somebody on the line.
Yeah.
Oops. See if we can mute. Yeah, see if we can mute people on the. There we go. Okay, someone
There you
was
go.
on. Yeah, so I think the issue is as the first travelers are going to be very tightly managed and monitored, and I think all the tools that travel risk management has will be utilized. So travel tracking, monitoring travelers during their trip, and then the final phase is coming back from travel. And if someone is going to a higher risk destination and they're returning back to a lower risk destination, then the question will be, should that person, when they return, still self-quarantine themselves? Should they come back to the office or not? So those are also some complex decisions to make. And of course, the traveler is going to want to know that they don't want to put their family at risk when they return home. So all of these are the factors that organizations are going to need to look at when they decide on that business essential trip.
Yeah, for sure. And then even when you open it up to international travel, right, which is an even more complex set of challenges there, what specific criteria or tips would you give for that type of travel?
Yeah, for international, you now have obviously it's a longer trip, and now you're crossing borders with additional levels of restriction, right? Or potential for restriction. And I think with international travel, it's even more complex because you have to understand the nationality and the citizenship of that traveler and where they're going. For example, if they wanted to go to Australia, you have to be an Australian citizen to actually arrive in Australia now. Any other nationalities are not coming in. So each country is going to have their own specific restrictions for non-citizens and how they come into the country. And some of those may require, self-quarantining for 14 days. And that might be part of your decision process, is that this trip is so critical that I know that when that person goes there, they can't do their work for 2 weeks until they pass quarantine, and then they can go do their job. So I think the restrictions are very important to assess, and the implications for the traveler. And the other thing to consider too is that these restrictions can change. So if the outbreak gets worse in that country, and if the outbreak gets worse in their home country, that can impact their return trip. So the monitoring of that international travel, or with respect to their nationality, where they are, and where they're going to ultimately return to, has to be part of that decision-making process. They might actually need to leave more quickly if things change or starting to change, or they could be delayed for a significant period of time if things change as well. And so when they're taking their, they have their personal health kit, they should be taking extra medications, assuming that they might get stuck for 2 weeks. They want to make sure they have all their medications with them, for example. So they need to expect that they may be significantly delayed at their destination. So international travel will be complex, and it will require, really close monitoring for the traveler as well as from the manager who's supporting that traveler.
Yeah, great points. And then this is something interesting. So we've been hearing a lot in the news about how the airport experience is going to change, and as it should. As an example, we've even seen Emirates go as far as to test every passenger before departure. So one of these changes is certainly around incorporating things like temperature checks as part of the new normal with security procedures. So Dr. Druckmann, when it comes to that, can you shed some light on how effective thermal cameras for screening passengers' temperatures are?
Yes, so quite a few organizations are moving to thermal scanners, and they're trying to find solutions for mass numbers of people going through a system and having a more efficient flow of traffic and using thermal scanners. I think there was just a Washington Post article, I think yesterday, talking about that they're not very effective. So I think the jury is still out as to ultimately how useful they are. I know that when we've used them at some major events during Ebola, they require a technician. You also still have to have a screener there, because if you do catch someone who has a high temperature, they need a secondary screen to confirm whether they actually do have a temperature. But again, I think it's a solution that's evolving. It's a little bit like testing too. Some of the tests that came out were not very effective. They're getting better as they go, and I assume our technology will continue to improve over time. I think we're probably not there yet for a super effective solution, but again, it's another tool in our toolkit of trying to identify passengers that might be febrile. And we have our sister company called MedAir, and MedAir is one of the international SOS companies, and we provide in-flight medical assistance to the airlines, to many of the airlines, and we're also helping them doing the boarding screening for people. And so we're right now working on a digital questionnaire tool for passengers, so that and so I suspect that these types of tools are going to be coming out within the next number of weeks, even, where when you get your boarding pass, there'll be a click to fill out a questionnaire, which will help you fast track you through the screening program. So if you've done your 6 questions or whatever, you show it to the agent, and then they just scan your temperature, and then you're through in a much faster, more efficient way. So I think these types of things are coming.
Mm-hmm. Yeah, for sure. And another thing that we've seen are airlines are investing more in the cleanliness of their aircraft and asking people to wear masks on board. In the US, I think it's American, United, Delta, and Southwest that have all enforced this already. So inquiring minds, and especially myself, I'm a heavy traveler here, but how likely are people to be exposed to the virus on a plane given the new sanitation efforts?
Well, so yeah, I mean, look, any time you're in a confined space for a significant period of time, that is a risk, for the coronavirus. I mean, if you had a choice between being outside versus inside, you'd want to be outside. And so I think that is a challenge for any kind of confined space. One of the pluses for being on an aircraft is that you have a rapid air filtration system. That's part of what's in an aircraft. It has HEPA filters in it, which filters the virus. So from that perspective, it's probably better, being in an aircraft than in some cases being in a place without good airflow. And I think as we look at hygiene and cleaning of the seats, and any touch surface, I think is where the risk comes in, is that you want to really try to reduce your touching of the workspace or any of your space in your area, and that you don't want to be touching your face. And really one of the purposes of the mask is to stop you from touching your face. And the purpose of the mask too is to not spread it to other people. It's going to be interesting to see the seating arrangement on aircraft too, because to keep social distance on an aircraft is not easy. And so we'll be interested to see how that layout is going to look. But what you also want to do as much as possible is not, direct, your breath path in front of someone else in order to have enough distance between them as well. So I think there's a lot of logistics that, the airlines are going to need to put together to minimize people's exposure and to have a strategy that everyone on the aircraft is doing their best not to pass the disease to anyone else.
Mm-hmm. For sure, and you hit the nail on the head here, because one of the questions was, does not having people in middle seats really mitigate the risk? What would you say to that question?
Yeah, look, I guess it comes back to no one likes the middle seat, right? Yeah, look, if the more distance we have, the safer we'll be. I still think, though, if you're looking at some of the research that's coming out, people are still more likely to become infected by touching surfaces than by being coughed on or breathed on. It's the more common cause. That doesn't mean that it doesn't happen. So the surfaces, and not touching surfaces is going to be a key issue. But keeping social distance as much as possible is definitely going to be a benefit. And the duration of the flight too is going to be a factor. And I think we're going to see a lot of travelers look at other routes of transportation if it's a short trip. Should I actually just get in a car and drive for 2.5 hours instead of fly, right? I think those are going to be decisions people are going to make for shorter trips. And I think the risk is definitely going to be for longer trips. The longer you're confined in a space, the higher the risk is. So the risk is really a combination of proximity and duration, right? So the longer the trip is, the potential higher risk you have of exposure. So it may mean that people might be safer on multiple leg flights as opposed to one long flight.
Mm-hmm. For sure, and I think this carries over really well into our last area where we received questions on, which was around antibodies and immunities. So as you're very well aware, more so us probably, but there seems to be so much information every day regarding antibodies. So how effective are these antibody tests?
Yeah, so this is again a very evolving subject, and there's basically 3 types of tests for COVID right now. You have the PCR test, which you've typically seen in the news, where they take a swab and do either your throat or your nose, and now they can, I think, do saliva as well. And then there's another one called an antigen test, which you can do with a swab too. The antibody test needs blood. So, and it can be done, in a typical lab setting where they draw blood from you, or it can be done in a rapid test with a finger stick prick. Now, the rapid tests are not as effective as the blood test, typically. The blood test kit, the blood test solution they've just released, a couple American companies have the blood test, which is actually looks like it's very accurate. Which is a really good news story. I think some of the other kits were probably not as accurate. And at the end of the day, though, the purpose of doing the antibody test is, in essence, to look at the community response and look at the community impact from a public health perspective. Because what the antibody test does is it checks whether you have been exposed to the virus. It doesn't say whether you are sick from the virus. It's really looking at whether you have been exposed. So you could be exposed and ill. You can be exposed and been asymptomatic. And then if you've developed antibodies, basically your body's response to this virus, the next question is, are you immune? Meaning, if you got exposed to the virus again, are you not going to get sick? Is your body going to fight it off? And we don't know the answer to that yet. So we're hoping and we're praying that people that have been exposed to the virus will be protected, but we don't have an answer. So all we can say today with the test is, yes, I have antibodies, and we assume that's a good thing because we're hoping that it gives a level of protection. The other question we don't know yet is how long does that last? So if we get the antibodies, does it last for 2 months, 6 months, a year, 2 years? And so, you would also need to check people's antibodies over a number of months to see whether it stays up there to be able to potentially give you that protective support. So there's a lot of unknowns, and typically, when you'd want to get an antibody test is if, so for example, if you have a spouse who was sick with COVID and you've been treating the spouse and you didn't become symptomatic, but let's say you would want to get checked to see whether you were exposed to it and whether you also developed some immunity to it. So that would be one use of the test. If someone was sick with COVID and never got tested, and you wait a few weeks afterwards and get them tested, and that they're positive, you could say, well, that they were exposed to the virus and most likely was related to that illness. So immunity is still a moving target, and you've heard this concept of herd immunity. In essence, what that means is that the whole community or the majority of the community becomes immune to the virus, and therefore if one person gets sick, if everyone around him is immune, that virus is not going to spread very well in the community. And that's what we mean by herd immunity. You might not get everybody, but the rest of the herd supports you. And so we need to get to at least 60, 70, 80% of the population to be immune, which is a huge amount. And really, you only get there, we suspect, with a vaccine. And that's what the vaccine does, is if we get enough people in the community vaccinated or develop antibodies to it, then it's very, very hard for the virus to pass between people, because the virus doesn't have enough people who are who are not immune that they can pass it to. So it's still watch this space. I think there's going to be more testing kits coming out, more ability for people to get tested. They're going to test communities to see what percentage of the population is immune or has antibodies, and then they're going to figure out, are people immune to it? It might take a number of weeks or months even before we really know whether it is giving immunity.
Mm-hmm. Yeah, and then I recognize this is probably a tough question to ask, and I'm sure you've been asked it before, but when do you expect a vaccine to come onto the market?
It'll be Wednesday. No, yeah. So look, it's a very good question, and I think there's a lot of research and testing being done already. There's human trials of the vaccine, and you may have read that what they're doing is they're doing what's called at-risk production, where basically they're producing the vaccine based on what they're testing, assuming that it's going to be successful, so that they'll have millions of doses ready when it passes its trial. But they know that if it fails its trial, they'll have millions of vaccine that they're just going to have to throw out. So that's why they call it at risk. So hopefully, and there's 7 or 8 or 9 trials going on, all with this concept of producing it in advance and hoping it's going to be successful. So that if they are successful, then we may have it a bit sooner. If they're not successful, then we have to continue with some of the other tests that are coming behind it. But I think what you're going to see is when there is a vaccine, and hopefully it'll be soon, when there's a vaccine available, the first people that will get it will be, our first line, medical professional workers. And then they'll look at hopefully the vulnerable, and then getting into the mass population as well. And then it also figure out how it's going to be distributed globally. So there's a lot of moving parts to this. And I think the practicality, most people are going to say it's going to be, hopefully early next year, where it's going to start to roll into communities. And that being said, it's going to be really important that people get their flu shot if for this fall in the northern hemisphere, because you want to make sure that you've maximized your immunity to the flu, because what we don't want to have is both coronavirus and flu cases in the emergency room at the same time. It's going to really overwhelm our system. And so make sure everybody gets their flu shot. That is available, and it'll be online, in its usual time frame around September, October.
Okay, that's a great tip. And then really just to round out the the webinar today, we wanted to end with continued education, just because one of the consequences of this modern era is the abundance of news, right? So many people are plugged in 24/7 between TV, Twitter, newspaper, Facebook. So it can really be overwhelming to keep up with everything. So just from your perspective, what are some of the best sources that you trust? And where do you recommend our listeners get their news from?
Yeah, look, I think I still think it's important that people rely on their local public health authority guidance as a starting point. Now, every community is different, and some communities are more effective, in their communication tools than others. I'm in LA County, and I think the work they're doing is amazing. They just came out with some really nice communication tools that are easy to understand. They're infographics, they're clear, they're pretty concise, and they have a real strong strategy for how the process is going to work and how people can help themselves. I think in the US context, it's the CDC still, even though there's political issues here, they are the world leader in this type of situation. This is what they're built for, is this type of crisis. And they also have some great content and great tools. If you're in Europe, it's the ECDC. If you're in Australia, it's the Australian authorities. Singapore does some amazing stuff. So I think starting with your national and even state, or in some cases local community communication tools are a great source. Obviously, we're going to be biased in some of our international SOS content, and so we have a lot of really good content for the traveler, for the employee. And so we try to consolidate it from all these multiple sources and make it more business focused, because I think obviously when you're looking at the public health authority, they're looking at the total workforce, the total community, and they're writing it for the whole community, whereas we're writing it more for the business executive, business traveler. And it's a little bit of a different angle from a communication perspective than kind of the mass public communications. So I would say, we're happy to kind of share what we're doing on that side. And I think that, you're also going to see within industries some good communication tools as well. So if you are, in the oil and gas industry, they've got some great, communication tools for within their industry and guidance coming out within their industry. So following industry best practices and guidance is also another place to go. And in the U.S. context, OSHA, has come out with and is, I think, going to continue to come out with guidance around, in the work for the worker, as a worker standard. So that's a place to look as well.
Yep, perfect. And then if anything this pandemic has taught us, it's certainly the importance of having a risk management platform in place. And with Corporate Traveler and Stage and Screen, we do offer a light version that's complimentary when you're a client of ours. But for those that are listening and they want to explore the benefits of a more robust solution, where would you suggest they can learn more about International SOS?
Yeah, so we as you can see, there's a link there, and that's a web link. There's also a contact number there that they can call us, and we're happy to kind of walk them through, what we have and what we're doing. It's a very dynamic situation, so what we're doing is literally changing every week. So it's worth checking in as to what we have now, and also getting a sense of what's in the pipeline. Particularly for your industry, because we're also looking at this by industry too. We're doing a lot of work with scholastic industry. We're looking at the heavy extraction industry, the tech industry. We're doing a lot of work with the tech industry. So even within your vertical, we can also share best practices too, because we're working with a lot of these companies already. So if you wanted to know benchmarking, we've got some cool benchmarking data as well, which we can share too. So give us a shout, and like I say, happy to let you know kind of what the lay of the land is from our perspective, dealing with hundreds and even thousands of organizations around the world.
All right. Well, thank you so much. That was amazing. I feel like I took a bunch of notes myself. Thank you so much to Dr. Druckmann for all the information and just taking the time to share your expertise with our clients and prospective clients and just our community in general here at Corporate Traveler and Stage and Screen. We really appreciate it, as well as the rest of the International SOS team. Ryan and Alice, thank you so much for your help in coordinating and making all of this possible. I know that there's been a lot of really important information shared today. So we are going to have a follow-up that goes out within 24 hours with some really interesting and helpful links provided by International SOS, as well as a recording of today's session. So I'll be sending out all of those resources and you'll be receiving those from us shortly around this time tomorrow. So stay tuned for that. Thank you, of course, to our audience for joining today. We really appreciate you taking the time to spend your Wednesday afternoon or Wednesday morning if you're on the West Coast with us. And if you do have any further questions about webinars, about today's subject, you can also reach out to us at the email address below. Go ahead and give us a shout. And thanks again, everyone. We hope that you enjoy the rest of your day. Talk to you later. Bye-bye.
Bye-bye. Bye-bye.